Come in.
Hi.
Hi.
My name's Liz. I'm going to be your nurse today.
Hi.
Just going to set some stuff up here. We're going to be doing a central line dressing change for you today, okay?
Okay.
Just going to wash my hands. I'm going to verify your orders, okay?
Okay.
Okay. There we go. Just going to go ahead and scan your wristband here. Can you tell me your name and date of birth, please?
COPD 212XXX.
Perfect. And that matches what I have on your chart. See, do you have any allergies, especially to tape or chlorhexidine or latex?
Nope.
Okay. The reason I ask that is because we're going to be doing a central line dressing change, like I said, and we use some of those materials in that procedure, so we don't want any reactions, okay?
Okay.
So before I get going, I'm going to verify that we do have an order in here for a central line dressing change, and then I'm going to go ahead and do a couple of med checks, because we are also going to be flushing your central line when we're done changing the dressing, okay?
Okay.
So I did my first check in the med room. I have sodium chloride, 10 milliliters, 10 milliliters for the flush, and heparin 1 milliliter, which is 10 units, to heparin lock. Okay, so I'm going to perform all of my checks here, and again, no allergies, so we're all good to go there. All right, I'm gonna come over here and just set up my space. I'm going to bring your bed up a little bit to a working height. Okay. Just gonna go ahead and lower this so I can see. And I'm gonna give you a mask here today. I'm wearing a mask as well, and that's just because this is a sterile procedure and we don't want to introduce any microbes or anything onto the site, so we can prevent infection. Okay, there we go. All right, so I'm gonna go ahead and set up my sterile field. A lot of materials to work with. I'm going to be careful to only touch the outer edges of this drape. Okay, now I'm going to go ahead and get some gloves, and we're just going to inspect your site and remove that old dressing for you, okay?
Okay.
So before I start, I'm going to go ahead and check and make sure that all of these lines are clamped, which they are, and they all have those protective end caps on, so we're good to go there. Are you having any pain around your site?
Nope.
Okay. So there's no sutures present on this. If there were, we would check and make sure those are intact. We're checking there's no redness, no swelling, and no signs of irritation or infection here. The patient doesn't have a new fever or any other signs of infection, so it looks like we're doing good. So now I'm just going to go ahead and remove this old dressing. You're going to feel a little bit of a pull when I take this tape off. So I'm sorry, kind of like a band-aid coming off.
Okay.
So we're going to start from this end and pull forward so that we don't dislodge that line at all, and I'm stabilizing it with my other hand. Again, sorry about the little pulling. We just want to be really careful that we don't move or dislodge this catheter during the process, okay?
Okay.
Perfect. We're going to remove that bio patch as well. All right. So now there's no signs of any drainage or crustiness. If there were, we could use these chlorhexidine swabs that we have over here to clean them up, but since there isn't any, we're not going to be doing that today. So I'm going to go ahead and wash my hands again, and then we're going to go ahead and put on our sterile gloves. Now that we have those on, we're going to go ahead and start cleaning. So I'm going to grab this 4x4 gauze and our swab. I would crack this to activate it. So we're going to go ahead and pick up the line with this, and we're going to clean around the site for 30 seconds. And we want to start on the inside closest to the line and then work our way outwards. So we're going to go ahead and clean that nice and good. And again, we're stabilizing here with this to make sure that we don't move the line at all. Okay, so then I would throw that away. I'm gonna go ahead and grab my new bio patch over here. And we're gonna slide that on. Okay. I'm gonna apply this and center it over the line. Get a nice good seal with that. We want to make sure that we have a nice good seal on there. Okay, that's intact. Okay, so at this point in time, the sterile part of the procedure is over, but everything is covered and intact here, so we're good to go there. Before I move on, I'm going to go ahead and just measure the distance of this line from the center down to the very end. And we do this, we're going to chart that just to make sure that the line hasn't moved at all. So that's at 17 centimeters. So I'll document that in the chart at the end. Then I'm going to go ahead and just secure the lines with tape just to make sure that we don't pull or tug on that at all and displace it while you're just moving around doing normal things. So we're going to go ahead and tape down these lines just again to further prevent them from moving. We're also going to put a piece of tape at the top where it's easily visible, and I'm going to label that with the date, time, and my initials so that the next nurse knows exactly when the dressing was changed, okay?
Okay.
I'm gonna put the date, time, and my initials. And that's clearly visible here at the top. Okay. So now we're gonna move on and do our flushes for the lines. So I'm gonna go ahead and use sterile technique to get this set up. I'm going to go ahead and prime this. That's at 10. We're going to go ahead and pick a line here. Some of these can be a little bit hard to unscrew. All right, there we go. The last nurse did a good job of putting this on tight. So we're gonna go ahead and drop that. Connect it, and then we're gonna unclamp. I'm going to aspirate until I see some blood return, which I see. So then we're going to go ahead and infuse this slowly over a minute. The reason that we're going to infuse that slowly is because this line goes directly into the heart, so we don't want to overwhelm the heart with fluid all at once. So we're going to go nice and slow. Perfect. Okay, and then after a minute we'll be done infusing that, and then we're going to go ahead and do the heparin lock as well. So I'm going to disconnect this and grab our heparin. And this is already at 1 milliliter. And like I said, we did our med checks on these drugs at the beginning. So we're going to go ahead and infuse that 1 milliliter. And that's an anticoagulant, so it's going to go ahead and lock that line and prevent clots. Okay, so that's done. We're going to go ahead and clamp. Maybe. There we go. And then just to further prevent infection, we're going to put on one of these new end caps. That is disinfecting end cap. Okay?
Okay.
How are we feeling over here?
Pretty good.
Doing good still? Okay. So we're going to go ahead and put you back. Oh, this one doesn't go down. I'll put you down on the other side. I'm going to collect all of my stuff. And we'll dispose of this properly at the end. And I'll take this all out with me. And we're going to go ahead and document that we did both the dressing change, the location of our central line, how long it was from the insertion, and that we gave the flushes. So we're going to go ahead and document all of that. Is there anything else that I can get for you today?
Nope.
Okay, we'll take that mask off since we're all done, and that'll do it.